Hello,
Yes, sir.
can you hear me?
Yes,
sir.
Hope you are fine. Hmm. Okay. Hmm. In our last class, we are talking about X-rays. In this class, we learn something on specimens. In your OSPE, you will usually get 1 or 2 stations on specimens. The common specimens which are given in the OSPE stations are, let us start from the upper part of the body, the thyroid, then breast, then gallbladder, stomach, colon, uh, then kidney, testes. These are the common organs. Other than this, there may be skin lesions and bones, the fractures of bones, osteomyelitis, and malignancy of bone. These are the common specimen which are very frequently repeated in the examination. And when you see a specimen, picture of a specimen, then first you try to identify the organ, which organ it is. If you can identify the organ, you can very confidently diagnose the pathology. Try to identify whether it is thyroid, or it is liver, or spleen, or it is gallbladder, etc. Actually, usually this identification is very easy because thyroid does not resemble as colon, or colon does not resemble as kidney. There may be confusion only in case of liver and spleen and kidney and testes. Then other organs, the shape, the appearance is very unique. Now come to the diagnosis. There are many diagnoses in any organ, but for your examination, if you can identify it is a thyroid, it is almost sure that the specimen is of multinodular goiter. In your examination, I have not yet seen other than multinodular goiter. I have not seen the thyroid cancer or solitary thyroid nodule, etc. Therefore, if it is thyroid, you can be almost sure that it is multinodular goiter. Therefore, identify the organ first, and then it will become very easy for you to diagnose the pathology. And then if you can say this is thyroid, you are sure that this is multinodular goiter, and then go through what are the findings of the multinodular goiter. That is the things, that is the tricks behind your OSPE examination. Now, let us see this specimen. Obviously, this is a thyroid. This is the only butterfly-like organ in the body. You see, it is a butterfly-like organ. This is the only organ with this shape in the body. Therefore, there should not be any confusion in diagnosis of thyroid. Now come to its findings. You see, the findings. This is a nodule. Here is another nodule, a separate nodule. Here is also a nodule. Here is also a nodule. Then, obviously, this is a case of multinodular goiter. When the section is cut, you can see the colloid within the nodule also. Colloid is grayish, dark gray, or black color. By that, you can say these are colloid. If this specimen is given in your examination, then write down like this way. Your question should be like that. What is the specimen? You write down this is a specimen of thyroid. Then what are the findings in this specimen? Then you write down that there are multiple nodules of variable size involving the both lobe of the thyroid, etc. Then this is a case of multinodular goiter. Anyone asking any questions? Then come to the next specimen. The same, the butterfly shaped organ, it is thyroid, and you can see obvious variable size, multiple nodes in the thyroid. Therefore, it is multinodular goiter. And also, there are, you can see the black color of the nodules. You see somewhere it is reddish, but in the nodules, mostly it is black or gray. This is the colloid within the nodule. This is a colloid filled multinodular goiter. The same thing. Okay, it's clear to everyone that there are multinodular goiter.
Yes, sir.
And the colloid, etc. Then remember, if you can identify a thyroid, you see the lobe, two lobes, and the isthmus. This is very typical shape of thyroid. Therefore, it is thyroid, and I have already told that if it is thyroid, you can almost blindly say that this specimen is a multinodular goiter, and then you write down the other things. There may be many things in the question. What are the pathology of these things? What are the treatment options? What are the complications, etc. Then you answer that way. Okay. The same thing. Okay. Then diagnosis of this case. Actually, in case of breast, usually you can find the areola and the nipple. Without areola and nipple, I don't think a specimen will be given of breast without areola or nipple. That will be a very bad question if a breast tissue is given without areola or nipple, because the skin all over the body looks same. If there is no areola and nipple, how can you say that this is a breast? Then what is the diagnosis? It is obvious. There is a lump here, and the lump involves the skin. There is induration, there is ulceration, and there are multiple vesiculations, etc. Then obviously this is a case of carcinoma of breast. Like thyroid, I told that in case of thyroid, you can blindly say that this is a case of multinodular goiter. And in case of breast, you can be almost sure this will be a case of carcinoma breast. Other than carcinoma of breast, other things will not be, I don't think, will come in your examination. Okay, look at this picture. Obviously, this is a breast because there is areola, there is nipple. And what are the findings? The nipple is retracted, indrawn, and there is superficial disformation in the areola and skin. There is powder orange in this area. You see, the skin becomes like an orange peel. Look at the skin here. Look at the skin here and look at the skin here. There are multiple dimples here. This is the powder orange. And this is the carcinoma breast. This is also the same thing, carcinoma breast. This has become skin become very red and thin. Probably there is some sort of mastitis carcinomatosis, inflammatory change. These are all same. Then I forgot to tell another specimen. It is very common, appendix. And if it is appendix, it is very easy to diagnose the appendix because the appendix is the only worm-like tubular structure in the body, which one end is blunt. And appendix, if it is appendix, you can blindly write down this is a case of acute appendicitis. Other than acute appendicitis, other appendicular pathology will never be given in your exam. Therefore, identify the specimen and then you can almost be sure that this is a case of acute appendicitis. Then how can you diagnose the appendix? A tubular organ. The tubular organ, one end is blunt and there are vascular markings on the body and there is major appendix. These are the major appendix. And the one end is blind and the other end, this end is attached to the cecum, which has been resected. Now come to this appendix. You see that this appendix, see the color, see the diameter, etc. And here, the color is dark color, not black, but blackish. It has not been gangrenous yet. The vessels are more engorged. The vessel can be seen very prominently, and the appendix looks engorged. You see the diameter, you see the wall of the appendix, it looks engorged. This is a case of acute appendicitis. You see the picture again of this appendix and this appendix. The vessels are there, vascular markings are there, but it does not look that the vessels are dilated. Vessels are not outside the serous port. And you see with the picture, it does not look like that the appendix has been engorged, appendix has been swollen. But in this picture, you see the vascular markings. This looks that the vessels are dilated. It has become dilated, tortuous, thickened, and the whole appendix looks, it is swollen. And the major appendix also swollen. This is a case of acute appendicitis. This appendix here, there is obvious pus formation, gangrenous, but the base looks like normal, more or less normal than the tip. You look at the tip, it is very red, fiery, and then there is pus. And you look at the base of the appendix, it is more or less normal. Then you don't have to write down about the base of the appendix, you write down about the tip. The tip looks more reddish than the rest of the appendix, and the tip is dilated, and there are obvious pus formation, and this is a case of acute appendicitis. You know, in acute appendicitis, usually the involvement is in two areas, either in the base of the appendix or in the tip of the appendix. Usually, here the involvement is at the tip of the appendix. You see this, you look at the base and you see the tip. Actually, probably there is some pathology here in this narrow area, and therefore from here the whole appendix has become swollen. And you look at the tip, tip is swollen, there is pus formation, and it is acute appendicitis. Again, almost same. Okay, here you see, this is the apex and this is the base. Here the involvement is mostly near the base. The tip and the surrounding area is more or less normal. The involvement is mostly on the base. Okay, these are appendix. All are appendix. I hope you can write down acute appendicitis. You see almost the same. The tip up to this area, it has become dark in color, blackened, swollen, and this area seems normal. Now, what is the organ? Can anybody say? What organ is this?
Gallbladder.
Bladder.
Yes, it is gallbladder. Gallbladder, the only organ, the pear-shaped organ, particularly the Indian and Nepalese. Pear is not a fruit of Bangladesh. Then this is a pear-shaped organ, a globular organ, and this is gallbladder. What do you think? Is this gallbladder is normal? Okay, you cannot. This gallbladder is not normal. Okay, let us go. See this gallbladder. Look at the wall of the gallbladder. You can see the contents of the gallbladder through the wall. Is not it? Actually, it looks that the wall of the gallbladder is transparent and the bile within the gallbladder can be seen. It is the normal gallbladder, though it is not actually normal. The normal gallbladder looks like this. Look at this gallbladder. You can see through the wall of the gallbladder. Now, see the first picture. This one. Does it look like normal? No. The gallbladder wall is thickened. It is very thick. And obviously, it is dilated. And there are some whitish discharge on the wall of the gallbladder. This is empyema gallbladder. There is obvious pus within the gallbladder, empyema gallbladder. Here also pus is there. Gallbladder wall is thick. It is more reddish and pus is there. Here also there are pus. These are all empyema gallbladder. These are all empyema gallbladder. The obvious pus is there. And also this has been cut. This gallbladder has been cut open, and therefore you can see also the stones and pus. Then in this case, you can diagnose the empyema gallbladder with polylithiasis or with gallbladder stone. When you can see stone, you can say the polylithiasis. Here also, there are stones and pus formation. Empyema gallbladder, the same thing, stone and pus formation. These are not open and therefore you cannot see the stones. And now come to this specimen. What do you see? How the gallbladder wall? Do you think it is thickened? It looks very thin. Actually, it is a wall is thin, and we can see the bile. What is the color of bile?
Green.
Greenish. Good. And you can see this bile can be seen. The greenish color bile can be seen through the gallbladder wall. Because the gallbladder wall has become very thin and it has become transparent, therefore we can see the bile within the gallbladder. Therefore, this is a case of mucocele of the gallbladder. While gallbladder is dilated, the wall becomes thin, wall becomes transparent, and there is collection of bile within the gallbladder. Actually not bile, collection of mucus, but that become greenish color or whitish color. And these are all same things. In this case, we cannot see any pus. We cannot say that we can only say that this is a case of multiple gallbladder stones. The same thing, case of multiple gallbladder stones. This is a specimen of gallbladder which has been cut open. We can see multiple stones within the gallbladder. Stones are of variable shape and size. Particularly look at the shape. These stones are multifaceted stones. Again, you see the shape of the stones. Some are triangular, some are rectangular, and some are square. And also you see the color of the stones. Some are more or less whitish, some are brownish, etc. Then this is a case of multiple gallbladder stone. Now you have to answer the other questions. What are the types of these stones? What are the other types of the stones? What are the types of the stone? There is cholesterol stone and pigment stone. The cholesterol stone and pigment stone. The cholesterol stone looks like cholesterol, you know, it is fat. And in body, fat is yellowish. And therefore, cholesterol stone is more or less yellowish in color. But pigmented stones that contains hemoglobin, it is the bilirubinate stone, and therefore it is more or less blackish in color. And there are mixed. Actually, most of the stones are mixed, where you can see some cholesterol with pigment. And there are other questions like what may be the complications of these stones, how the present may present to you, etc. and etc. I have not seen any ultrasonography given in your examination yet, but I think at some point, maybe this year, maybe next year, it may become to your exam, because ultrasonography is one of the commonest investigation nowadays. Therefore, there may be an ultrasonographic image in your exam. Look at the image. You know, this is the shape of the organ, this is gallbladder. This shape is of gallbladder. And it is homogeneously black within the gallbladder. It is homogeneous, almost black. There is no other echogenic shadow. And the wall, the gallbladder wall, this is a normal gallbladder. But look at this picture, this image. This is gallbladder, all right, this is gallbladder, and it is black, homogeneous. But what is this shadow? There is a shadow within the gallbladder. Look at the shadow. Here there is no shadow like that. Then this is the stone, and stone in the gallbladder, and which produces a shadow behind that. This is a case of gallbladder stone. This area is an echogenic structure producing an echolucent shadow below. At some point of your exam, it may come, I think so. This is also gallbladder, and you see the echogenic structures. This is also gallbladder, and you see the echogenic structure, and you see the shadow below. Then multiple structure, echogenic structure, and you see the multiple shadow. You see, every stone has formed a shadow in it. Then forget about the ultrasonic image of the gallbladder. Let us come to the specimen. In your, if the specimen is gallbladder, most probably you will get an specimen of empyema gallbladder. You will get a specimen of empyema gallbladder or gallbladder stone, polylithiasis. Rarely you can get the mucocele of the gallbladder. Other than this, I don't think you will get a specimen of carcinoma gallbladder or etc. or any other pathology. Most probably you will get the empyema gallbladder. Remember that you will get the empyema gallbladder. Then the secondly, you may get the gallbladder stone. The diagnosis of gallbladder stone is very clear cut. You can see the stones, and rarely you can see the mucocele of the gallbladder. Just try to understand the difference between empyema and mucocele. Empyema, the wall is thick, it is irregular, there may be pus or other things adherent to the gallbladder, but in mucocele, the gallbladder is wall is very thin, it becomes transparent, and you can see the content of the gallbladder through the wall. Then this is gallstone. Gallstone. Okay. Now, what is this specimen? Can anybody say?
Staghorn calculi.
Staghorn calculus. Good. Staghorn calculus. Here a single stone because it is Staghorn calculus. Staghorn calculus. Where it is formed?
Pelvic calyces.
Pelvic, good. Pelvic calyceal system of the kidney. You say like that. Pelvic calyceal system of the kidney. This part of the stone was probably in the pelvis, and these are all the calyceal system. Probably this part is in the ureter, and these are the lower calyx, middle calyx, and the upper calyx, etc. Pelvic calyceal system. What are the composition of this stone?
Phosphate.
Yeah, what? What is the composition of Staghorn calculus?
So calcium phosphate.
Calcium phosphate. Not only calcium phosphate, actually we say this is a phosphate stone or triple phosphate stone. Calcium phosphate, magnesium phosphate, and ammonium phosphate. Usually the combination of these three, calcium phosphate, magnesium phosphate, and ammonium phosphate. Usually these are phosphate stone, and phosphate stone usually becomes very large. A large stone is almost always phosphate, and the wall of the phosphate stone, the surface is smooth. You see the surface of the stone is smooth. Forget about this part. This part has been actually impregnated within the calyxes. Otherwise, it is more or less smooth. And the color, it is, we say the dirty white color or chalky white, looks like chalk or dirty white color. This is the phosphate stone. What are the other types of stone in the urinary system?
So oxalate stone, uric acid stone, urate stone, then
Uric
cystine.
stone and urate stone is almost same. It is uric and urate stone. Okay, xanthine stone, cystine stone, etc. But the most important is phosphate stone or triple phosphate stone and oxalate stone. You have to know the difference between these two stones. Already I have told about the character of the phosphate stone. Phosphate stone is large, but oxalate stone is very small. Phosphate stone, the surface of the phosphate stone is smooth, but oxalate stone is spiky. And the color, the phosphate stone is white and oxalate stone is black. Why there is difference? Because oxalate stone is spiky and therefore it produces very early symptom. It produces pain, it produces hematuria very early. When it is small, it creates symptoms and therefore it is diagnosed early and therefore we get the phosphate oxalate stone at a small size. And why the color is black of the oxalate stone? Because the oxalate stone is spiky and therefore it injures the wall of the pelvic calyceal system. There is bleeding and the blood, when it disintegrates, it becomes black, and these black particles are deposited on the stone, and therefore oxalate stone is black. Therefore, come to the difference again. The wall of the phosphate stone is smooth, and the oxalate stone is spiky. We say it is like mulberry, or it is like in our country, it is like jackfruit. The spiky projections all over the surface of the stone. And therefore, the oxalate stone is symptomatic, but phosphate stone is asymptomatic. It is silent. Therefore, oxalate stone is usually small, phosphate stone is usually large. And the oxalate stone is black in color and phosphate stone is white in color. And this is also the same thing, a large stone, it is phosphate stone. It is also phosphate stone, the staghorn calculus. These are all staghorn calculus. But this is a very smooth stone, very smooth. Only in bladder the stone can be so round in shape. These are the bladder stone, and this is the oxalate stone. You see the surface. It is spiky, and therefore it produces early symptoms. This is oxalate stone, and you see these are black in color. This is also oxalate stone. This is an very early X-ray of a staghorn calculus. These are oxalate stone. Now, what is the organ?
Kidney. Kidney.
Who says stomach? Who says it is stomach? Okay. Look at the shape of the organ. the normal shape. And look up these things. This is a kidney. Look at the color, look at the shape, the hilum of the kidney, and the pedicle of the kidney, the ureter, the artery, veins, etc. This is obviously a kidney, but there is something else. The upper pole of the kidney has become very enlarged, and it is very distended. Then what is your diagnosis?
Renal cell carcinoma.
Yeah, it is a tumor. A tumor. A tumor in the kidney. And it is the upper pole is involved here. It can occur anywhere, but usually the renal cell carcinoma is more common in the upper pole. It looks like that it is sitting on the kidney, on the head of the kidney, and therefore the other name is hypernephroma. It is above the nephrons, therefore hypernephroma. This is renal cell carcinoma. The rest of the kidney is normal. You can see the other picture, the same thing. In the kidney, the part of the kidney is normal, then there is an enlargement things in the kidney, and it is you can almost blindly say that it is renal cell carcinoma. It is renal cell carcinoma. You see, this part of the kidney is normal and this is abnormal. You can see the kidney, the pelvic system, etc. But here it is abnormal. It is a kidney. Actually, kidney, it is dissected and then opened up. Probably the same picture, the kidney and the tumor. Here the tumor is in the lower part of the kidney. What is the time? কয়টা বাজে? আমাদের টাইম শেষ। ওকে, আপনাদের কি 30-এ 20-এ? ওকে, চলে আসেন। ওকে স্টুডেন্টস, for today this much is enough. This is again the renal cell tumor. This is also renal cell tumor. You see the normal kidney, and a tumor is here. The renal cell tumor. Okay, up to this. Then if it is kidney, you can almost be sure that this is a renal cell tumor. Okay. The ophthalmologist is also already present here. They are knocking at the door, so I am leaving for today. Thank you and best wishes. Hope you will stay home and stay safe.
Thank you, sir.
Thank you, sir.
Okay, what is about Nepal?